Thanks for, Senator, for coming this morning, and thanks for your leadership on the issues that we're going to be talking about. So you just heard some of the statistics here. Chronic disease is the number one cause of death and disability in the United States and in California. 40 to 50% of residents in this state have at least one chronic condition. And as we found with this issue, chronic conditions come in bundles. So people generally don't just have one, they have multiple chronic conditions, which makes the treatment algorithms and protocols all the more complicated. 70% of deaths are related to chronic disease in this country. Roughly 83 to 84% of spending on healthcare is associated with patients that have a chronic healthcare condition. This has been a remarkable change over the last 20 years. If you go back to the mid-1980s, for example, about 2/3 of spending on healthcare was linked to chronic disease. Today it's over 84%. And the biggest growth area has been among patients that have multiple chronic conditions. So as I like to say, it's just to give you sort of a clinical picture of the patient that we're talking about who's driving much of the spending here in California. It's an overweight, hypertensive diabetic with bad cholesterol, asthma, pulmonary disease, back problems, and is depressed. So that's our patient. There are multiple medications. That patient cuts across a wide range of different parts of our healthcare system, and it's really not integrated, coordinated in any coherent way. These issues are even more telling in the Medicare program. They own the chronically ill population. Not only is most of the spending in Medicare, over 95%, linked to chronic disease, most of the spending increases in the Medicare program are linked to chronically ill patients. So about 90% of the growth in Medicare spending since the mid-1980s is associated with rising prevalence of chronic disease. And you see the sort of same patterns at the state level, in Medicaid programs and in private insurance. Nationally, it stands at about 34% of adults are considered obese. That's doubled since the mid-1980s. And that doubling of obesity is associated with a whole range of increases in chronic disease prevalence.